Good evening. Welcome to the Ask Me Anything with Dr. Twyman. I'm going to help you guys become heart attack proof. Today I uploaded many of my videos back since December. I had a glitch in my YouTube to AI transcription workflows. I finally figured it all out. So all my prior Instagram Ask Me Anything since December, they're now on my YouTube channel, which is just youtube.com/@drtwyman, like my name is spelled up here. Or if you go to drtwyman.tv, it links to the YouTube video. So if you're looking for any of the old archives that are more than 2-3 weeks old, the YouTube channel is what has it. So welcome, everybody. We have some great questions tonight, so we'll just jump on into them. First question up tonight, ApoB is 104. This would put you above the 50th percentile. They're an overabsorber, so this means that their gut generally increases the reabsorption of sterols, including beta-sitosterol and composterol. If you would like this number to be lower, the best treatment option is Ezetimibe. Plant sterol supplements work for some, but you got to make sure you don't have sitosterolemia, mouthful. If you have that and you take plant sterols, then you absorb the plant sterols into your bloodstream, and plant sterols can be more atherogenic than your body produces. Can hibiscus tea lower blood pressure? Yes, it's a very mild effect, potentially systolic blood pressure dropping 5 millimeters of mercury. Generally, got to drink 2 to 3 cups of hibiscus tea for this effect. Is there a drug, therapy, or supplement that can decrease calcified plaque? The short answer is not really, and that's not the goal. The goal is always to stabilize plaque and reduce the risk of cardiac events. So not having a heart attack, stroke, need for stents or bypass surgery, or dying. Some therapies actually cause the softer non-calcified plaques that potentially tend to rupture. They cause them to calcify. That can include statins in particular. So the goal is to stabilize the plaque, not necessarily to get the calcifications to decrease. On occasion, I have seen CT coronary calcium scores decrease, but that isn't the goal. Strophanus extract used by some practitioners for heart health, not myself. What's my perspective? It's similar to digitalis, so unless you know how to use digitalis, you should be using this medication. It can cause some heart arrhythmias if you don't know what you're doing. So no great clinical trials that I can see. It's more anecdotal, more common, I believe, in Germany. So I would not highly encourage people to use this one. You need to know what you're doing. Can plaques break off? The short answer is plaque can rupture, and it's the softer plaques that tend to rupture. If a person is getting a coronary intervention with a stent, during the stent deployment, the plaque can embolize downstream and occlude the microcirculation. So how do you prevent it? Looking at blood work can give you an idea if you have significant vascular inflammation. So if you have high LPPA2 activity, if you have high myeloperoxidase, if you have high interleukin-6, plaque may be more vulnerable. What to do about it? Treat the inflammation, treat the oxidative stress. If you have low nitric oxide, fix why you have low nitric oxide. So avoid mouthwash, avoid proton pump inhibitors, eat dietary nitrates, mostly green leafy vegetables, get your sun exposure with UVA sunlight, exercise so blood flows across your glycocalyx and nitric oxide gets released from your underlying endothelium, lower uric acid if it's elevated, lower homocysteine if it's elevated, supplement nitric oxide if you need it. So there are many ways to stabilize plaque, and that's what we focus on at my practice, Apollo Cardiology. Do people over 70 normally have higher blood pressure? Age is the main risk factor for increasing blood pressure. What we consider high for age, optimal is 120/80. Older trials, used to say that 160 was okay, but that's if you don't want dementia. No, you definitely don't want to overtreat hypertension in elderly and get them lightheaded, dizzy, falling, and breaking hips. But 120/80 is optimal. That is the kind of the sweet spot to decrease cardiac events such as heart attacks and strokes. So always start with lifestyle interventions first. Exercise, treat sleep apnea if present. Consider the DASH diet or Mediterranean diet if you need to change up your diet. Figure out if you're low in nitric oxide, treat your inflammation, oxidative stress, and then if blood pressure still remains elevated, consider pharmaceutical intervention. You can use genetic markers to figure out the pharmacogenomics to see which medicines might work well for you, but often it's an ACE inhibitor, angiotensin receptor blocker, or calcium channel blocker to start. This question that was pre-submitted tonight, and then we'll answer any of your questions in the comments. So somebody says that their advanced lipid test showed that their large particles were 8,600 and their small particles were 248. So I would imagine that the large particle is actually not that high because I generally don't see them greater than 3,500 on most panels. But if your particles are really that high, then you very likely have familial hyperlipidemia and need to assess, do you have atherosclerosis? So you may want to consider a GP Insight panel that can tell you, do you have an issue with your LDL receptors? Do you have an ApoE4 allele or some other polygenic cause why you have such high LDL particles? But think of particles predict risk, more particles, more risk of atherosclerosis. Maybe not in the short term, but long term. We're not talking just 5 years, talking 40 years. And for those that are in my school community, I dropped a research article that I helped develop in Google Gemini last week that looked at the relative and absolute risk reduction with lipid-lowering therapies. It looked at the lipid hypothesis from a standpoint of Mendelian randomization trials, observation trials, randomized control trials, gave a red team argument for why the lipid hypothesis may not be correct. And then my 2 cents was that, you have to look at your underlying risk. That helps you determine which treatments to consider for lipid-lowering therapy if you're interested in lowering your lipids. So that's the end of the pre-submitted questions. If there's anybody who wants to drop a question in the comments, happy to answer it. While we're waiting for that, the call to action is always, if you're ever interested in having your questions answered, please just put them in my stories. I drop my question box early Monday morning, and I answer them in the order received. If you're wanting more detailed education from myself, my kind of one-to-many platform is School Community, spelled with a K, SKOOL. But the way to get to that community is it's becoming heart attack proof on the School platform. You can go to drtwyman.com/school. There is a free 7-day trial if you are interested in checking out what it's about. I have a community of members who are optimizing their vascular health span and lifespan. We had an Ask Me Anything last week where we went about an hour and a half through people's questions. I have a couple courses up there. One is how to read your own labs. That's a question I get routinely from patients and people on social media is I don't understand these lab reports. That's what my specialty is to help you understand this. So if you're interested in those kind of courses, check out the School Community. Well, I'm not seeing any other questions come in. I'll hang out for another minute or so. For those that are just joining, I did drop many archived Ask Me Anythings on my YouTube channel. I had a glitch in how my Gemini AI was reading the YouTube transcripts, figured it out today. Also figured out some very cool things with Claude. I'll let you guys know about that once I get a little bit more under me on how to get these MCP servers attached to Claude. But if you haven't been utilizing AI for looking at how to optimize health, get ready. This is going to be very big in 2026. So I appreciate you guys' time and attention. Check out my YouTube channel. It's drtwyman.tv if you want the archives of the prior Instagram lives. Check out my School Community if you want more in-depth education or the more in-depth Ask Me Anythings. I did do a pretty decent podcast last Friday with a hormone replacement doctor. I don't know when exactly it's going to be released, but it'll get released and some of the stories will drop on Instagram probably in the next week or two. So very interesting if you're interested in hormone optimization, if you're interested in testing to look at for optimizing vascular health. Check out that podcast when it drops out. So hope you guys have a great week. We'll see you next Monday, 6 p.m. Central Time.